The case study: Edward Bear developed dementia. This was his experience and that of his partner Emmy with healthcare. Edward Bear had an active life. He also enjoyed the quiet times. He lived with his sweetheart Emmy. They joyfully gathered honey. Dementia entered their lives through no fault of their own. Ed became forgetful and disoriented. His walking was unsure. His peripheral vision was not clear. It is scary to be worried. People come up behind you and you get frightened. He tried his best, and he had friends. Emmy had his back. She was exhausted. What I really need is overnight care occasionally so I can get uninterrupted sleep, she said. The doctors said it was unsafe for Ed to be at home. He was falling, and Emmy couldn't lift him up. They moved him to a care home. Ed wanted to live at his home. Emmy missed him so much. She visited 3 times a day. The workers did not make time to get to know him. Ed forgot how to feed himself in the care home, so Emmy helped. Strangers came to change him. He felt unsafe. He resisted as any self-empowered bear would. They wrongly believed he had bad behavior. Resistance is not fighting. Ed was trying to let them know his needs were not being met. The health workers wanted him strongly medicated. Ed felt like his life was in danger. How can life in a chair watching old TV shows be called a life? To the few kind and patient nurses and health workers, Ed was known as the gentlest bear around. Sundowning is common with patients experiencing dementia. Ed wanted to socialize in the evening. They had closed all the doors. He let them know the only way he knew. Their response was to call the police, and he was taken to the hospital tied down in a squad car. In the emergency ward, he was strapped down with 6 restraints. He couldn't move. Early the next morning, Emmy was devastated to find her beloved Ed in the emergency ward of the local hospital, tied up like a terrorist, guarded by 2 security guards. Now he was treated like public enemy number 1. He had the dreaded purple dot on his file: violent, angry, aggressive. 3 workers pounced on him in fear each time he needed to be changed. Emmy helped Ed to walk, but it was soon impossible because he had been strapped in too long. How different it would have been if there had been a kind approach. Ed stopped eating and drinking. He gave up. Emmy insisted they go home, as it appeared he would die soon. At home he lay where he could be close to nature, surrounded by things he loved, with friends visiting, and Emmy spending precious time with him. The palliative physician, nurses, and health workers trained by hospice brought kindness and dignity to Emmy and Ed. Why only now? and remembering the two things that are necessary when we're really trying to develop a deeper presence with one another is being still, being attentive, and relaxed at the same time. So as you're sitting, as everybody's sitting, notice your body, your feet on the floor, or your body against the chair that you're sitting on, and just notice what that's like. Just be present to it. We're doing this as an exercise so that we can actually develop more presence when we are actually attending to other people. So notice your body, and notice your breath, your in-breath and your out-breath. You're not thinking about your breath, you're being with your breath. You're doing this on purpose, remembering that the more present we are with ourselves, the more able we are to be present with other people. So people who have probably previously noticed maybe a more shallow breath or whatever, just go, as I've said before, to the breath itself. Accept it with the same kindness and calmness, whether it's shallow, whether it's deep. Don't change it, just stay with it. So your breath is coming in and out. We use the breath because, as this practice, it's not about the breathing. We use it because it's always with us. We don't have to create any kind of tool to become present and more present in our bodies. Have the attitude towards this time of being present that this moment matters. This moment is a new moment and it really matters. And that's why we attend. We attend because it matters. In this moment, as I'm with you, you matter and I matter equally. As you are going through your body, as we've done before, notice any tension. So if you notice tight spots, don't change them, just go and attend to them. Just be with them, with kindness towards ourselves. And move intentionally at the moment towards your heart area. And just feel as you're breathing, the heart is open. If you find tightness around that area, just stay there with gentleness and kindness. Your heart is open. Open to yourself and open to the next experience of being with someone else. So we're with ourselves first, and then we are aware of someone else. Notice whether you have unconditional positive regard for yourself in this moment. Just notice, what is that like? you notice something happening in your thinking mind, go back to the sensations, because we're very conditioned to think our way through our lives. But for this presence practice, we are in our bodies with sensations. So unconditional positive regard for ourselves will lead to unconditional positive regard for others. And be aware of your thinking for a moment. Just notice if you're projecting any thoughts on your experience. Oh, I'm really relaxed. Oh, this feels good. Actually, I'm feeling a bit tired. Just notice that and see how seductive it is to be making comments. And when you notice those comments, go back to your sensations. Feel your feet on the floor. Notice the sensations of your feet in your shoes. You're here to be present. And the practice is constantly coming back to your body. If you notice yourself getting lost in your thoughts, it's okay. But the point is to notice yourself being lost in your thoughts and come back to your body. So I want you to imagine, as you're doing the practice, we're going to add another dimension to it. Picture someone in front of you who is coming and wants your attention. Wants you to be attentive to them. So take in what they look like. You know who they are, or you might not know them. And then notice in your body whether you're having any thoughts about the person. Oh, I didn't expect to see you. Whatever it is, and just bring the practice back to your own body. So you're noticing the other person without bias and judgment, just openness. And back in your own body. It's sort of like that figure of 8 we were doing. Take care of self, take care of others. So just keep the practice, noticing your breath. Think about for a moment a person you work with or someone in your family. And first of all, bring somebody that you really like. Again, notice your body. Notice your response in your body. And just be aware of it. And you're moving between you and the image of the person that you are really fond of. And just notice what happens. Feel your feet on the floor. Feel your heart open. Now bring someone into your awareness. Since we're doing this individually, we'll be doing it with partners later. Now bring someone in that isn't really, you don't really know them that well. It might be a neighbor, might be someone who, the checkout person at the supermarket, or, someone you see, you kind of know them, but you don't really have particular fondness or aversion towards them. See who shows up. And notice, are you as alert? Are you still alert? Are you still relaxed as you were with your first person? And for this last part, bring somebody into your awareness that you have difficulty with. See who shows up. And do the same practice. Have a look at them and then go back to your own body, your own breathing, and notice your responses in there. Not just in your body, but also in your thinking mind. Just be aware of, is this different? And don't go into an elaboration of that, just noticing. Just noticing. This is someone who causes me difficulty at times. Can I sit with the same kindness and open-heartedness with this person who is difficult? And who sometimes doesn't let up? Can I be patient? Can I be kind? And really do it from a sensory point of view, from your body response. Then come back to yourself. Be really present to yourself. Are you noticing any pain, any stiffness? Go there with the same equanimity, the same degree of compassion and openness towards yourself this time. So any uncomfortableness, go to that uncomfortableness with kindness. As I've said before, this practice is literally transformational. It's about my example of milk and yogurt. It's something transforms in the milk when the conditions are right. And it really helps with biases. I want you to think about, in the same state, I want you to think about someone with characteristics that might lead to your bias. And be brave. Allow that to come up. I want you to actually feel the bias, first of all. Notice the bias. Oh, I really don't like people like that. That kind of thing. And allow the bias to come up. Don't pretend that you're not experiencing it. Actually allow yourself to experience it. Notice your bias. Now go back to your body, ensuring that you're in your body and you're noticing, what does bias do inside my body? It's not good or bad. You need to recognize bias when it's in there. And what happens in your mind? What are the thoughts that you have? But stay with yourself. Don't keep feeding your bias by focusing on the other person. Feel your feet on the ground. And know that your integrity, particularly in this training of being with people with compassion and equanimity, that you can do that by focusing on your body and attending to the parts of you that have been conditioned in a way that does not lead to openness, kindness, compassion. Notice whether you're still alert. You're doing this present moment awareness on purpose because it's a good thing to do. It brings more kindness into the world. So as you kind of come back to the room, I'm going to ask you just to sit, open your eyes and maybe take a look around and just notice what reflections you're having about the practice. And if you'd like to, bearing in mind that this is being recorded, if you want your voice to be heard, then I'm inviting any kind of insight you have. While you were doing the practice, what did you notice? And which was easier for you to stay relaxed with? Which caused, more uncomfortability inside of you?
Thinking about somebody who I was fond of, I felt a lightness in my whole body.
A lightness, yeah. Yeah, so it's easier if I like the person. Yeah. How many others had that experience, that it was a little bit easier when you had a fondness for the person?
Sure.
Yeah, sure. Okay, what else, what other insights did you get about yourself?
A simple thing that I found was I was mentioning about feeling I was breathing shallowly.
Uh-huh.
When I didn't think about my breathing, I just thought about slowing the world down and relaxing and slowing my whole body down. I found I was breathing much deeper.
Okay, so the relaxation response in itself, without even focusing on the breathing,
Yes.
caused your breathing to change.
Yes.
Yeah, the conditions.
Mhm.
Yeah. What we don't need to do is to create relaxation. We can actually attend to it. And in the beginning, it's really useful to create conditions for relaxation. It is. And that we can help our people with when we're sitting with people. We can actually ask them, because some people don't relax easily at all.
Mhm.
So we can ask what helps. And that starts, and then attending to it, just to the sensations in the body, will change it anyway. Just work with it, experiment with it, and see. Any other insights before we close this time off?
I appreciated your pointing, what I took my attention to, what you call seduction of the naming of things. It brought more awareness to my mind naming. So much so that I was naming, and then I watched, oh look, I'm naming. And then, does that make sense?
Yeah, of course it does.
Mm-hmm.
Other people experience that too. You notice your thoughts and the seduction of thinking. And one thought leads to another thought. And if you get in early, you can actually make the correction. It's sort of like driving, right? When you're already spinning, it's hard. And they talk about monkey mind for a good reason. It's like do-do-do-do-do-do going on in our minds. And sometimes for very busy people, as I'm sure you can identify, that when we're wanting to help somebody quickly, and we're actually busy, and we're trying to fit it in, what's going on in our mind? Like, how long is this going to take? And yeah, what's your name? Oh, your name is so-and-so. Yeah, okay, let's deal with what we're going to deal with. Have they experienced any of your presence? No. That cognitive, you can still work quickly, but quietly. And the person that's with you will respond in a like way, because our nervous systems are interconnected. We're not separate from one another. Yeah, thanks for the practice. Can you just